Hello, I'm Rachel Maier and I'm a physical therapist at Central Maine Therapy Services. I've been a physical therapist for the past 24 years and currently specialize in treating patients with lymphedema. If you've been diagnosed with breast cancer, you may have heard a little about lymphedema as you have met with your doctor to talk about treatment options. However, you may not have a very good understanding of what lymphedema actually is or how to manage it. The goal of this webinar is to provide you with a better understanding of what lymphedema is, as well as some of the signs and symptoms of lymphedema. Also, we'd like to help you understand how physical therapy can help you with your treatment and care, especially with regards to lymphedema. So to start to better understand lymphedema, you need to have an understanding of your lymphatic system and what it does. Your lymph system is part of your immune system, or in other words, the system within your body that fights off infection and damage to cells. Your body has over 700 lymph nodes throughout it. These lymph nodes are connected with vessels that are separate from your veins and arteries and are located in the space between your skin and muscle. To simplify it, your lymph system picks up fluid and other cells that can't get picked up by your veins. Your lymph nodes filter this fluid, then return it back to your heart. You have lymph nodes in your breast and chest that filter fluid from your breast. If you have cancer in your breast tissue, some of the cancer cells may have split off and been picked up by your lymph system and brought to the nearest lymph node to be filtered. With your cancer treatment, one or more of your lymph nodes may have been biopsied to determine if the cancer has spread away from the initial area. Different cancer treatments involve the removal of lymph nodes, and sometimes nodes can be damaged as a side effect of your cancer treatment. Usually, a normal lymph system has the ability to handle quite a bit of fluid, typically more than you would ever need it to. However, the removal of lymph nodes or damage to your lymph system decreases your ability to drain fluid. In other words, you have a backup of fluid that your lymph system is no longer able to handle. And this causes the area between your skin and muscles where those vessels are to swell. This is lymphedema. Now, lymphedema is different than regular swelling for a couple different reasons. First, swelling that you get when you sprain your ankle is mostly water-based fluid and it's easily absorbed back into your veins. Lymph swelling is mostly protein and not able to be picked up by those veins, so it can stay in those tissues for a long time if your lymph system is damaged. Also, lymph swelling is in that space between skin and muscle, and other swelling is usually within a joint or deeper in your tissue. This is why patients with lymphedema may need help to drain the fluid, as this swelling is different than normal swelling. Because lymph swelling has a lot of protein in it, and because it is so near the skin, a backup of lymph fluid can cause changes to your skin. This could be color changes. Your skin might be pinker or purple, or sometimes even a brownish color. Also, your skin can feel different. It can be thicker, bumpy, cooler, or warmer, or it could even be weeping where some of that lymph fluid drains out of your skin. Some of these skin changes can make it harder for your body to fight off infection or heal after a rash or wound. Not everyone that has radiation or has lymph nodes removed will have lymphedema. It depends on how well your body can move the fluid. Some signs to watch out for include swelling. Some patients who develop lymphedema may have a lot of swelling or only a little. The swelling may be in the chest or breast, could be in your armpit, the side of your chest, or even into the arm on the same side as your cancer. Sometimes the swelling will start soon after surgery or radiation, and sometimes it could start months or years later. Some people will complain that their arm may feel different or heavy. Some patients will notice that their rings are a little tight and they can't see some of the creases on the involved side as on the uninvolved side. Many of the patients that I see want to know how to cure lymphedema. And unfortunately, once you have lymphedema, you will always have it. But you can learn to manage it. And this is where seeing a therapist who specializes in lymphedema care can help. We can teach you some of the ways to control the swelling through massage, compression, good skin care, and exercise. Early detection can help you manage these symptoms much better for the long term. Physical therapy may also help before surgery or treatment. The therapist is able to help you get a baseline of what your motion and strength is, and also to get some pre-treatment measurements. During this session, the therapist will provide you with some easy exercise to maintain your motion and strength, and hopefully assist in putting your mind at ease about what to expect after your breast cancer treatment. So in summary, lymphedema is a fluid backup of your lymphatic system that can be managed with the help of someone trained in treating lymphedema. If you are someone who has been diagnosed with breast cancer and are experiencing signs of lymphedema, talk with your cancer team to see if a referral to therapy would be helpful for you.